Connective tissues are made of collagen and elastin. Together they form a matrix that covers, supports, and protects structures and organs that aid in movement. With connective tissue disease, the collagen and elastin are damaged through inflammation or immune system dysfunction. Examples of connective tissue include bone, cartilage, tendons, ligaments, lymphatic tissue, and bone marrow. Osteoarthritis involves cartilage loss with formation of bony outgrowths called osteophytes at joint margins. It involves stretched collateral ligaments leading to joint laxity, looseness, and instability, muscle atrophy, sclerosis or cyst formation in subchondral bone, which lies below the cartilage, and edema and fibrosis of ligaments, which results in greater pain and restriction on joint movement. Risk factors for developing osteoarthritis includes being a female, being over the age of 55, obesity. Osteoarthritis often involves weight-bearing joints such as knees, hips, feet, and the lumbar spine. Obesity often correlates with development of knee osteoarthritis. Other risk factors include occupation, such as jobs that require physical labor, sports activities, previous injuries, muscle weakness, genetics, and history of inflammatory arthritis, bone and joint disorders. Clinical manifestations of osteoarthritis include pain and joint tenderness. This often improves with rest, decreased range of motion, fatigue, bony and soft tissue swelling, deformity, unsteady gait, and crepitus. Remember, crepitus is the air trapped under the skin, and this is due to the cartilage breakdown in the joint. Diagnosing osteoarthritis involves obtaining labs to rule out other diseases such as rheumatoid arthritis. We'll get into this further into the presentation. Imaging such as X-ray, CT scan, bone scan, or MRI. This can reveal joint space narrowing, subchondral sclerosis or cyst, and presence of osteophytes. Non-pharmacological therapies include weight loss if obese, physical therapy and occupational therapy. This includes range of motion, muscle strengthening through the use of low-impact exercises, use of ambulatory devices. Other non-pharmacological therapies include energy conservation, application of heat or cold, and social support. Pharmacological therapy includes acetaminophen and NSAIDs, intra-articular steroid injections of corticosteroids or hyaluronins. Corticosteroids decrease inflammation and hyaluronins provide lubrication to the articular surfaces. Opioid analgesics for extreme pain, these should be used sparingly, and other over-the-counter products such as Bengay. Rheumatoid arthritis is a chronic, systemic, autoimmune inflammatory disease that causes pain and swelling to freely moving joints. It is caused by an unknown antigen that triggers an immune response that damages synovial tissue. It results in the destruction of cartilage, erosion of bone, and increase of synovial fluid. Although less common, the patient can experience inflammation of the lungs, heart, skin, kidneys, blood vessels, salivary glands, bone marrow, and or nervous system. Risk factors for rheumatoid arthritis include being a female, age, It's more prevalent in those that are greater than 30 years old. Genetics and environmental factors such as smoking, exposure to bacteria or viruses. Clinical manifestations of rheumatoid arthritis include joint pain and swelling, stiffness in the morning, irreversible joint damage and deformity, rheumatoid nodules that are mobile and non-tender, osteopenia, which is decreased bone density, muscle weakness and unsteady gait, warmth and erythema of joints, fatigue, scleritis, which produces ocular pain, pleuritis and pleural effusion, pericarditis, anemia. The client is at increased risk of infection. They may develop a fever. In the image, you'll see the boutonniere deformity, ulnar deviation, and swan neck deformity. Diagnosing rheumatoid arthritis involves combining symptoms, lab values, and imaging. Symptoms often persist for at least 6 weeks. There may be evidence of synovitis with palpation or ultrasound. Laboratory tests may reveal a positive anti-nuclear antibody titer and rheumatoid factor. The client may have an elevated CRP or ESR. MRI may detect bony erosions and joint space narrowing. MRIs may also be used to assess the client's response to treatment. Renal and hepatic function may be affected by treatment. CBC, there could also be a drop in blood counts. If the client had TB in the past, it could be reactivated by treatment. Many of these non-pharmacological therapies are similar to the therapies for osteoarthritis. Range of motion exercises should be performed. The client may be referred to physical therapy and occupational therapy. They should use assistive devices. They should maintain a healthy diet, alternate rest with activity, apply heat or cold, and the client may undergo surgery to remove rheumatoid nodules. Pharmacologic therapies for rheumatoid arthritis include NSAIDs, opioid analgesics, prednisone, immunosuppressive therapy, biologic therapy such as Remicade, disease-modifying anti-rheumatic drugs such as Rheumatrex and Plaquenil. Biologic therapy and DMARDs alter the immune system to decrease inflammation and slow the disease progression. The first line DMARD is the Rheumatrex. Juvenile arthritis results in pain and inflammation in multiple joints. It can occur as early as 2 years of age. It commonly affects the knees, ankles, and hips bilaterally. Risk factors include multiple genes causing inflammation and an immune response, stress, abnormal hormone levels, trauma to joints, and infection. Treatment of juvenile arthritis includes controlling pain and inflammation. This can be done through positioning, splinting, application of heat and cold, NSAIDs, methotrexate. We'll want to preserve the function as much as we can through the use of range of motion, aerobic exercises, physical therapy, and occupational therapy. We want to promote normal growth and development, as well as promote psychological well-being. This can be done by giving the child more time to complete activities of daily living, scheduling rest periods, identifying strengths and trying to boost their self-esteem, and decreasing any anxiety. The client should be monitored for uveitis, which is inflammation of the iris of the eye, nutrition deficits, growth disturbances and delayed puberty, and psychological issues. Systemic lupus erythematosus is a chronic inflammatory disease that can affect any organ system. The etiology is unknown but can be triggered by multiple factors such as pregnancy, exposure to sunlight, illness, major surgery, silica dust, and medication allergies. Risk factors include women during childbearing years, African American or Hispanic descent, and having a family history of lupus. Clinical manifestations are diverse and do not follow a clinical pattern. There are periods of remission and acute disease flares. Clinical manifestations are attributed to antibodies and the creation of immune complexes that deposit into tissues. Men are more likely than women to experience renal disease, skin manifestations, laboratory abnormalities, neurological involvement, thrombosis, cardiovascular disease, and vasculitis. Women are more likely to experience Raynaud's phenomenon, photosensitivity, and mucosal ulceration. There is not one specific test that is used to diagnose lupus. 4 of the 11 criteria must be present to support the diagnosis. The criteria can include the malar rash, discoid rash, photosensitivity, oral ulcers, non-erosive arthritis, pleuritis or pericarditis, renal disorder, neurological disorder, hematological disorder, immunologic disorder, and a positive anti-nuclear antibody test. A CBC is often drawn as patients may experience leukopenia, thrombocytopenia, and anemia. A BUN and creatinine is drawn to detect kidney disease. A CRP and ESR can identify inflammation, and coag studies to detect thromboembolism. Non-pharmacological therapy for lupus includes avoiding prolonged sun exposure and applying sunscreen, at least SPF 50, maintaining a well-balanced diet, getting regular sleep, and alternating rest with activity. Pharmacological therapy includes the administration of NSAIDs and Plaquenil. Plaquenil is used to treat fatigue as well as skin and joint manifestations. It can prevent disease flares and serious organ disease and can be used in combination with glucocorticoids and immunosuppressive drugs. Oral contraceptives should be avoided due to hypercoagulability, and live vaccines should also be avoided when on immunosuppressive drugs.